Good morning and welcome to the second meeting of the Health, Social Care and Sport Committee in 2026. I've received apologies from Elena Whittam, MSP, for today's meeting. The first item on our agenda is for the committee to agree to take items 3, 4 and 6 in private. Do members agree to taking these items in private? Yep. Thank you. The second item on our agenda is to take oral evidence from a panel of witnesses on the draft climate change plan and its implications for public health in Scotland. This is the first of two panels providing evidence as part of this committee's scrutiny of the draft climate change plan, with the second panel scheduled to give evidence at next week's meeting. And I welcome to the committee Professor Jill Belch, co-chair of Air Pollution Working Group, Royal College of Physicians of Edinburgh, Professor Ruth Doherty, Chair in Atmospheric Sciences, School of Geosciences, University of Edinburgh, Professor Peter Scarborough, Professor of Population Health, University of Oxford, and Dr Andrew Sudmat, Edinburgh Climate Change Institute, University of Edinburgh, and both Professor Doherty and Dr Sudmat are joining us online. And we'll move straight to questions, and David Torrance.
Thank you, Convener. Good morning to witnesses. Do you think the policies and proposals set out in the Climate Change Plan will improve indoor and outdoor air quality, and are they drawn on the best available evidence?
May I answer that? I think that the ambition for outdoor air quality is reasonable. There is the ambition to reduce the air pollution. In terms of where they have missed out something important, they haven't talked at all about ozone. And ozone, as you may know, is not something that Scotland really controls. A lot of it comes from Europe and from England, and it can damage health. But the problem is when it mixes with the VOCs, the volatile organic compounds, which are things that come off paint, which come off fuel, which come off industry, even chairs and couches and sometimes vegetation. And what happens then is that these VOCs stop ozone from being metabolised. And there's nothing in there about any legislation to have fuel covered or to reduce paint spillage, that type of thing. So my impression is that's one thing missing. And the second is ammonia. Ammonia, as you know, comes from urine and manure and fertiliser. And when ammonia is hit by increased temperatures, it combines with NO2 and SO2 to form ammonium nitrate and ammonium sulfate, which are PM 2.5s, which, as you know, are the most toxic compounds. So there are things you can do. You can cover slurry, you can have legislation for that, and the way you spread it, and you don't fertilise during high temperatures, and that has been, in my opinion, missed. Otherwise, external air quality, I think they really have done well. They have summarised the literature. Internal air quality has hardly been touched on. And some of you may know that the Royal College of Physicians Edinburgh wrote to the government asking that wood stoves not be permitted in the new builds. Wood stoves produce about 20 to 29% of all the PM 2.5s in the UK. And there's only about 8% of people burn wood in the UK. Now, that may well be higher in Scotland because of our rural community. The problem is we're now introducing, thank goodness, legislation for warmer houses and for insulation, but in itself that will stop air circulation. And there's excellent work out there showing that DEFRA, these so-called eco-stoves, produce about 400 times more PM 2.5 than gas boilers. And of course, electricity produces none at all. So to me, those are the three missing components in the air pollution climate change document.
Any other witnesses? No? Okay. Could there be any unintended consequences for health or inequality from these policies?
Sorry, just in general about air quality?
Yes.
Just in general, yeah? Or,
yes.
Right, okay. Unintended impacts around health inequalities.
Yes.
Okay, so I do work on food and diet, so I'll only speak on the kind of agriculture elements of it. Actually, I don't think there's any kind of particular impact on health inequalities or public health inequalities, let's say that, from the proposals that are put forward in the agriculture draft climate change plan, because there's not really any policies in there that would change consumers' diets. So it just seems to be very much based on agriculture and on technologies to kind of reduce the average emissions of kind of food produced, rather than changing the type of food that's being produced. In the actual climate change plan, there seems to be almost no commitment to changing diet. There just seems to be a commitment to changing the way that food is produced. And so as a consequence, if there's no real health impact, then I don't really see there's much impact on health inequalities. So that would be my impression for the agriculture section.
In terms of air quality, I think we all know that air quality actually promotes health inequality very strongly, and therefore there will be benefits as we reduce it. The issue is that one of the ways we are reducing air pollution is to use more electricity, and there might be some concerns about battery chemicals if they are placed near communities. The other issue is that you probably are familiar with the community councils that are all banding together in Scotland because of the concern that a lot of the electricity generation, which does have some disadvantages for people who live in close by, although I'm not convinced of that, they feel that they are not getting the benefits. So, for example, the Scottish Government will have community benefit from wind farms, but there is nothing for solar farms as far as I'm aware, and therefore people close to solar farms are having their green spaces removed, which of course is really important for health, but they are not getting cheaper electricity. And there is, as I'm sure you know, unfortunately a groundswell towards trying to reject planning permission in a number of places, basically because there's no perceived advantage to the Scottish population.
Brian Whittle.
Thank you, Gavina. Good morning to the panel. I'm really interested in the data around diet and change of diet. I had a meeting yesterday with Food Standards Scotland about their report, and I was quite pleased to hear that they had the same concerns as I do, in that I think the overconsumption of red meat is a problem, but underconsumption of red meat is also a problem. There's no differentiation between in the plan between red meat, white meat, or other kinds of sort of processed meat, which is a worry. So I just this idea of this generalisation of reducing meat by 20% and then by 2030 then 35%. That doesn't lead to a healthier diet. So I just wanted to get your understanding on where these figures come from.
So just to be clear, I mean, like the Committee on Climate Change report is very clear that it's got a pathway around meat consumption that is about kind of coming down. I couldn't see that. I mean, maybe I'm missing it, but in the climate change plan, it talks a lot about agriculture and a lot about technology, and looking in the annexes, it's got like a kind of goal around 70 grams of red and processed meat diet, but it's certainly got no policies in there about how you would actually kind of change diet. So I'm not sure if it's even in the first place, but even if it's, but in terms of the,
I'm talking about the Food Standards Scotland report.
Okay, the Food Standards Scotland report
that's
underlying
been interpreted.
Yeah. Okay. So the question, it's really about what's the evidence kind of around whether for health benefits around kind of reducing meat consumption in general. So there's clearly different categories of meat have different health impacts, of which the ones that we have the best evidence around the health impact are around red meat and around processed meat. That's clearly the case. So we know the impacts of red meat and processed meat on cancer risk have been well documented. And although, I mean, you've got to be careful with this, yeah, right? Whilst the risks are, the evidence is as strong as the evidence supporting between tobacco consumption and health outcomes. That's certainly the case for processed meat. It's slightly lower for red red meat. That doesn't mean to say that the effect size is as big as tobacco. So we don't want to kind of like sort of just like conflate those, but just to understand kind of like sort of the evidence level, that there's good enough evidence out there to kind of support it. There's then further evidence from observational studies relating kind of red meat and processed meats and generalised meat consumption with things like obesity levels and diabetes and cardiovascular disease. So there is evidence out there that if you're reducing your meat, particularly your red and processed meat, then you are kind of improving overall public health concerns. Now, I understand as well, in your question, you were saying, but if you're reducing too much meat down at kind of the lower ends, then you've got concerns in terms of micronutrient consumption and vulnerable groups. That's certainly the case, but I mean, you could argue that would be the case for a lot of different kind of dietary goals. With a lot of dietary kind of situations, what you're looking at is to say, right, we're going to hit kind of the sweet spot, yeah? And at the moment, the kind of meat consumption levels are too high. They could do with coming down, and yet if you're reducing kind of meat consumption levels, then you obviously have to be concerned if you're shifting that distribution on the people who are already eating quite low levels, and you've got to be looking at kind of their how you protect to make sure that those people are getting adequate nutrient diets and all this kind of things. But that doesn't mean that you shouldn't be kind of looking also at the high end. So I would support that. And indeed, with the Food Standards Scotland's goal around 70 grams of meat consumption, the idea was to kind of that was ramping up that ambition to kind of reduce meat. So that was kind of like sort of reducing the level below what's kind of suggested in the UK, because the modelling that was done to support that was basically saying, okay, if we reduce it to this amount, not only would it have public health benefits, it would also have benefits in terms of particularly around climate change, but other environmental aspects as well.
I have to say, on your answer, what really concerns me again is where I agree with you, processed meat, get it out of the diet, for sure. But when you're starting to talk about obesity and diabetes and linking that to red meat, when actually, of course, it's linked to much higher intakes of sugar and refined carbohydrates and all that sort of nonsense. That's where we need, surely that's what we need to be tackling. We should be eating what we can produce. Because under this trying to go up from a climate change perspective, we're ending up going to import most of our food. And surely that must go against the climate change objectives.
So in terms of obesity, I mean, obesity can be related to more than one thing. So yeah, it's like it is related with sugar and salt consumption, and but it's also related with red meat consumption. I mean, I think it's the evidence out there. It's you know, if you're reducing meat consumption, you see a reduction in body weight levels. You see a reduction in diabetes levels.
We've eaten red meat for ad infinitum, and obesity has become a problem in the last 20, 30 years.
We haven't eaten red meat levels to the level that we're consuming at the moment.
Tell me how that is related to red meat.
Red meat levels in consumption in the UK are at historically high levels. I mean, like they're slightly scaling down. But if you look at them in terms of the amount of consumption over time, they're far higher than they were in, say, like the 1940s, 1950s, and everything. So there's I mean, it's...
But is that processed? Are we talking processed meat, or are we talking fresh meat that we produce? Are we talking processed meat? What are we talking about here?
I mean, both are going up. I mean, both have been going up since the 1940s, 50s. They're both higher than they were. I mean, this is where we're at. I mean, you know, meat has become a kind of a staple within the diet that it historically has never been. You know, it has been for the last 30, 40 years. I'm not suggesting that there's anything going to change there, but it's been at historically, you know, high levels compared to the way that it has been, you know, throughout, you know, most of human history, the levels. And also in the West, I mean, okay, so there's countries where meat consumption are much higher than in Scotland, but still levels in Scotland are higher than the global average and higher than a lot of countries that got much healthier diets than us. For example, like Japan or Italy or...
Just finally, do you think that we should be doing more? Because generally speaking, the production of meat has a high carbon footprint globally.
Yep.
But the way in which we produce meat in this country compared to the United States or the Far East or Argentina, in my view, is what we should be exporting. That knowledge we should be exporting. Should we be differentiating between the way in which red meat is produced from a global perspective?
Yeah, without a doubt. But there's the goals. The Committee on Climate Change carbon budgets are quite clear that by 2045, that's when it really kind of cracks up that you're going to really need big changes in agricultural production. It's quite clear you're not getting that without big reductions in livestock numbers and without changes in the diet. The demand it's in there, and it's a balanced pathway about how we're going to get there. Now, a lot of that in the balanced pathway for the agriculture and the diet change is towards the end of those budgets and those pathways and kind of moving towards there. And I agree that if the only thing that you do in Scotland is tackle kind of the agricultural production and you don't tackle the demand, then what you're talking about there is saying, well, OK, if you reduce the amount of Scottish meat that's available, then it's just going to be replaced with imported meat from other markets, which might have worse climate impacts and probably would do. So what you need to be doing is tackling demand at the same time. So demand and supply come down at the same time, and then you've got the benefits that you're freeing up all of this land that you can then use, as it's mentioned in its land use section report, for all of the carbon sequestration potential and all the other environmental benefits that are available to that. But changing diet and these kind of dietary changes, they're definitely possible, but they take time. Yeah, so it should be policies that are thinking to bring in place now, which is just making more lower meat, healthy, sustainable, not zero meat, not by a long shot, but lower meat diets, just kind of reducing that amount of meat, is just going to help reduce the pressure on the system and allow us to kind of achieve the balanced pathway that the Committee on Climate Change has put together.
Am I out of time?
No.
Because I think this might be one of the most important things that we discuss in the whole year in the health of the nation, because the reality is that, as I say, my worry is people like, especially young girls, people who are not eating enough meat as it is, reduce their meat content even further. We're already getting to the point where they don't have the micronutrients they have, and it's all very well talking about this from a study perspective, but the practicalities of creating a healthy diet, when in reality is what you can't do in Scotland is switch over from all the dairy producing to do arable. We don't have that kind of land. We've only got 11% of arable land in Scotland. And we are very good at producing dairy, we're very good at producing meat, we're very good at producing root vegetables and fruit. And if that's what we ate, we'd be very healthy. But we're not. And now my worry from this report is that, is from a climate change perspective, is that we'll actually be worse, because we'll be importing not just meat, but all the substitutes that are suggested. Should we not be eating what we can produce locally and procuring what we can produce locally? That would tackle climate change and much more effectively, and health as well. I
think that's what is suggested by the Committee on Climate Change report and its balanced pathways. That's exactly that we should be eating what is produced within Scotland, within a healthy, sustainable diet. But in order to do that, and in order to get the agricultural sector down within the net zero targets that the Committee on Climate Change has set, you're not getting there without changing the diet somewhat. I agree there's challenges there. Of course there's challenges there. And there's groups that need to be particularly considered with any kind of dietary change policies that are kind of brought into place. But that doesn't mean that we shouldn't do it. That doesn't mean that we should just say, well, let diet kind of continue as usual. If you don't tackle the demand side in terms of diet, then we're definitely going to be getting into a position where we need to be kind of exporting, and we've got less control over the kind of food that's in the system. And also, you're missing all the potential public health benefits, because if you're tackling this kind of demand side, then actually what you're talking about is setting up like sort of public health policy which helps people achieve healthy and sustainable diets, and that's only going to be beneficial. It's not going to be based completely around meat, by the way. That's not. Obviously, that's if you set up your entire public health policies just to kind of just take one product and say, right, that's what we're going to be reducing, then you're going to have lots of different side effects and you're going to have problems with that system. If you set it up around saying, right, let's make food culture, let's increase people's food knowledge, let's increase people's food understanding, let's make sure that our food environments are set up so that healthy and sustainable choices are easy choices to support people in making those purchasing decisions, those cooking decisions, give them the skills and the abilities to be able to make those healthy, sustainable foods, then it's going to be going far beyond than just the kind of the meat that they're putting on their plate. We're talking about sort of changing the kind of culture so that people have those practical skills to be able to kind of cook a wide variety and varied diet.
I agree with you in terms of just one very small point. I do agree with you very much on changing the food environment in which we work. I think you're tackling the wrong thing.
Emma Harper.
Thanks, Convener. So I grew up on a dairy farm, and I know that South West Scotland has 48% of Scotland's dairy herd. I know the farmers are producing their dairy products, their milk, their in the most climate-friendly ways. That's what the goals they have to do. So I'm interested in whether, you know, I don't want to vilify the food producers in Scotland, because each farmer is going to be required to have a whole farm plan that covers goals towards achieving net zero, right? So I'm interested in the issues around like air quality, ammonium nitrate. There's a lot of products that are helping support emissions reduction, especially in dairy farming. We have nitrate vulnerable zones, which means you spread your slurry at certain times and to protect watercourses. So there's already actions that are being done by our farmers across Scotland. So the last thing I want to do is vilify our food producers, and I'd rather not offshore our red meat to somebody else who might not be producing it with the best welfare or climate mitigation measures in mind. So, with that said, I'm interested in, I suppose, recognising that everybody needs to collaborate and work together to achieve emissions reduction, to support what we can do to, reduce emissions in food production. Is that a fair enough thing about we need to collaborate and work together?
May I comment? I couldn't agree more. I mean, one of the things that I felt was missing was food security. There wasn't very much on that. And you made the point, we import 2/3 of our food. Now, let me just suggest to you that when we had COVID vaccines, remember India stopped doing it and kept them for their own population. And there was a fight with France and Brussels because they were making vaccine for us. And so when climate change gets to the extent that food security is a problem across Europe, they're not going to let their own population suffer and produce food for us. And so I think rather, I understand the debate about meat and the reduction, but for me, the pressing issue is food security, and we need to grow and produce our own. So I agree with what you're saying, and at the same time, take the precautions against the emissions that some of the farmers are taking. But I would point out not all of them, and that's why I think we need some legislation for sustainable farming.
And Fitzpatrick.
Sorry, it was just to go back to the air quality issue as well.
Okay, very briefly.
Okay, are we seeing more or an increase in chronic obstructive pulmonary disease or lung health issues because of wood-burning stoves? And I know we have concerns about that as well in rural Scotland, when that might be the only way to heat your house.
Yeah. One of the issues is that in the UK, PM 2.5 from wood burning it's about 20 to 29% of all PM 2.5s. And there is no doubt that where you have high wood burning, you have increase in asthma and COPD. One of the big issues is that people raise the rural argument, and I understand that to a certain extent. But let me tell you that therm for therm, electricity and wood burning costs the same, and in fact wood burning is slightly more expensive if you're purchasing your wood. If you're not purchasing your wood, which a lot of folk don't, they pick it up, they don't dry it, and then it really is a killer wood. Similarly, if you take it from building sites, building site wood is treated with arsenic and other chemicals, and you may know that in 2023 in London, the arsenic levels were almost at a dangerous level from people taking wood and burning. So what we need is legislation which is sensible, which for a start excludes wood-burning stoves in towns and cities and allows our countryside to burn them if that's what they do as a start. and then gradually improve our stoves. There's a huge marketing from the stove manufacturers. I'm afraid I complained and their adverts were removed. They are not accurate in a lot of what they say. And there are very good studies from Ricardo, our own Ricardo in Glasgow, showing that the eco stoves produce as much 2.5 as having a diesel lorry in your sitting room.
Well, okay, thanks.
Joe Fitzpatrick.
Thanks very much. I kind of want to follow on the discussion about food security, but maybe looking at it from that aspect, because I think that's quite a good way to look at it. So I think it is possible for us to actually eat less meat, to have a healthier diet, but still make sure that we're buying more of that meat from this country, so that we're kind of getting to the point that Brian Whittle was making about, clearly meat that's produced in Scotland is going to be less of a carbon impact on in the atmosphere than something that's come from Australia. So real concerns about the current agreements we have, arrangements that is effectively allowing massive amounts of lamb in particular to come all the way from the other side of the world, which cannot be good for the climate. But looking at food sustainability wider, obviously we're talking about protein here when we're talking about meat. So in Dundee, the fields around Dundee produce massive amounts of beans and peas. I think most of the broad beans that you get in supermarkets come from the fields around Dundee. So that's a source of protein which clearly has a huge health benefit, but plus an environmental benefit. The other source of protein that I think maybe we don't talk enough about that we should do, and again Scotland's right at the top there, is fish, and encouraging people, if we're having meat, to eat more of that really healthy fish. Jill, do you want to go first?
Yes, absolutely. Fish is very rich in particular omega acids that are really good for really the heart, for the brain. And yes, I would encourage fish eating. And in fact, oily fish are the ones that are the best. And please eat the fish, don't supplement, because the omegas that are taken for supplements are used from the krill catching. And as you know, some of the whales are dying now because the krill are all being removed, and a lot of that krill is going to make omega supplements. So what we need to do is eat real oily fish and not take supplements.
Preferably from the seas of Scotland.
Absolutely, from the seas of Scotland.
Thank you. Peter.
I mean, I don't have much to add other than say that I agree with you completely with beans and legumes as good alternative protein sources, if you want to call them alternative to meat anyway, as a good mix. They have got so much lower in terms of climate change impact than red meat or white meat production and so they're a good, healthy, sustainable choice.
Thanks. Before I move to Paul Sweeney, just to put on the record that we're having some technical problems with our contributors online. Hopefully those will be resolved soon. Paul Sweeney.
Thank you, Convener. Thanks to our panel members. Just wanted to pick up on a supplementary on this point before moving on about the lack of a mental health focus in the draft climate change plan, when for some climate change has had a massive impact on their mental well-being. I think in cases in Glasgow where an increase in rainfall, for example, has caused significant increases in flooding incidents, for example, people's homes. In a recent study by the British Association for Counselling and Psychotherapy, 57% of UK adults say their mental health was impacted by climate crisis, and yet this hasn't been considered, as far as I can see, by the climate change plan. So just wondered if you agreed that there needs to be a greater focus on mental health when considering the impacts.
Yes, I completely agree. From my own point of view, I'm quite keen on air pollution, and when they reduced air pollution in London, there was an 18% increase in productivity and a massive fall in sickness. And we know, for example, that as you become an adolescent exposed to a lot of air pollution, you lose the ability to pay attention, your behaviour degenerates, and these changes are permanent, and you end up with depression, and they're permanent because the damage to the brain is permanent. And I think you're absolutely right. Flooding in particular, it's not just the grief of losing your possessions, it's actually the fact that it can happen again and again and again. And as you know, we do need to mitigate and prepare, but unfortunately flooding tends to be repetitive, and that's not the only climate change issue. Heat, extreme heat, also causes significant depression and unhappiness. One of the problems is that we tend in climate change to measure the number of days over 25 degrees. But in Scotland, our average was 18.2 degrees, and hospital admissions increased by 10% when we get to 22.6 degrees. And these people are living in houses that are cold in winter and very hot in summer. And that's why we really do need to pay attention to mental health, because it is causing a lot of problems, both heat, cold, damp houses, air pollution. The whole thing affects mental health.
Thank you. Professor Scarborough?
I don't really have anything to add other than to say climate change anxiety in the young in particular is a big thing on the rise, and so I agree with you, mental health needs a kind of focus in a good comprehensive climate change plan.
Thank you. Just to move on to the points around financial costs and benefits of the plan. We do know that there are significant financial pressures on local government. Did the panel think that the current funding model of mental health services in Scotland is robust enough to meet the demands of the climate crisis?
I'm sorry, that's not my area, so I really don't know enough about that area to give a comprehensive answer.
Yeah, I can comment. Unfortunately, they are not adequate. For example, in my own area in Dundee, the waiting list can be a number of years to be seen, particularly for young adults. It's a difficult issue because I do agree that mental health is so important, but there is a difference between anxiety and genuine mental health problems, and we haven't learned how to separate those out properly in terms of delivering our mental health care. It is going to get worse with, as you say, the climate change problems as they arise, and so we do need to fund them. But on the other hand, the councils are pretty strap-cashed, and it's difficult to see in the front that in the future, for example, air pollution costs about £100,000 to £200,000 or NHS per year in Scotland. That's Public Health Scotland data. But if you add to that unemployment because they're sick, the benefits bill and things like that, it goes up to 1 to 2 billion per annum that it's costing Scotland. So if we can get rid of some of the other ill healths, then perhaps there will be more available for things like mental health. And of course, if you're out working and happy and not sick, then you're not going to have the same mental health issues.
I think it's interesting, this point about systems thinking and approach, and just wondered if you could perhaps comment on the Scottish Government's financial assessments of the co-benefits of the actions described in the draft plan and how they can be used and understood alongside modelling done by the ECCI.
I think some of our contributors online are actually from ECCI, aren't they? So they're probably best placed to kind of comment on that. I don't know if they're available at the moment.
Maybe bring them in if they get connected. But also just maybe perhaps about how local authorities, integration, joint boards, health and social care partnerships, health boards, etc., can better signal in their budget planning these impacts. Do you think that there does need to be better support to national policy identified in the CCP? How do you tie that together in a coherent way? It's one thing to have a plan over here, but if it's not got a linkage to operational plans, it might not actually have any real impact.
Can I comment? Because one of the issues here is acceptability of communities, and everybody has their priorities for council funding. And I think what we need to do is educate. I know a lot of people are aware of climate change, but I don't think they're aware of the significance of climate change. And I think that what we need is a publicity campaign run by the government so that it is credible, with billboards explaining why we have to have LEZs, why we actually have to cut emissions and reduce cars. The pressure to drive cars is absolutely huge. And of course, if you don't have a car and you're disabled or you're elderly, it is very difficult. But we do have to educate people that, for example, active travel, if we introduced active travel all over, we would save probably about £75 million per year. And again, that's Health Protection Scotland data. So it is about educating people, and the councils would then find it easier to bring in these changes if people understood them. And I think that really is missing. I don't know how we would do it, but my view is that we take out ads in newspapers, we fill billboards, and then people will understand why councils are making the climate change decisions that they are.
Just wondered, you mentioned a public kind of health approach. Do you think there's also a kind of continuous professional development programme needed within the public sector and additional guidance? So, for example, financial controllers within certain departments, planning, budget allocations, how do they actually model correctly the benefits if they're not envisaged or understood? As an example, for, say, planning a railway line or planning council services such as proactive street cleaning or removing blocked up drains that don't flood people's houses.
Absolutely. I think that there should be a health expert in the planning department, and unfortunately that often isn't the case. And so instead of having an obligatory 15-minute village, you're having urban sprawl, because the developers like the fact that the sewage and the electricity, etc., can just be extended. And I think that if we educate our planners, and my view would be that health should be integrated into every decision, planning included, so that there is somebody there at government level assessing the health impacts of the decisions that the planning officers make.
Yeah, I mean, good infrastructure is like the bedrock of public health, good public health, and that includes, physical infrastructure, but also kind of training and getting the right people with the right skills and the right expertise involved in those decision-making processes. So I agree with Jill entirely.
That's really helpful. I think just that point about how it links to things like national planning framework, stag appraisals for transport, etc., would be quite interesting to explore further. So thanks.
Just go, Hani.
Thank you. And a declaration of interest as a practicing NHS GP. Good morning, panel. Unfortunately, we don't have the other panellists on, so I'll try to limit my questions. It was sort of wider ones I wanted. But if we talk first about polluters, the NHS is one of the biggest polluters across the UK. Of its pollution, two of the biggest ways that it pollutes is travel, with people and logistics driving vehicles, and the other is prescriptions, especially of aerosols. So would that not be a really easy first target that we should be looking to account for?
Scotland NHS actually won the European prize for its NHS reduction in aerosol use. And what we're trying to do at the moment is make sure that pharmacies will take them back and renew them, rather than have repeated prescriptions of the same type. So actually Scotland is well ahead of other countries, not perfect, but well ahead of other countries in terms of the asthma inhalers. They also are changing the anaesthetic gases. Now, that can cause a problem because the anaesthetic is slightly lighter if you don't have the greenhouse gas anaesthetic gases. And so that's a learning curve. So that is coming in a wee bit more slowly. But you're absolutely right. We need to electrify the NHS transport. And that is in your climate change document, that should happen. The other problem, of course, is plastics. We use a lot of plastic. And so what we're trying to do is change the type of plastic that we use, because some plastic is recyclable and others is not. And we're trying to change to the recyclable plastic. The big issue is, of course, that we must be clean, so we use a huge amount of water. But what I think is good is that there is now some money to put solar panels on hospitals, coming centrally from Westminster, but not as much as was given to England, obviously. And I feel that that's something that, again, could be put in the document, that we need to have more. We're all going to use more power, so we need to have it locally generated, and we should make use of all these flat hospital buildings that we have.
I mean, that's certainly another question that I was going to have. So it's very expensive for the individual to be doing all the things that are being asked of them. So, for example, whilst you can say if you were to insulate your house, you would see a benefit over time, that initial cost is way too much for a lot of people to be able to afford to do. So should we not be using government facilities and government buildings and publicly owned things to essentially start to put the money into solar panels, put the money into our heat pumps and renewables and ground source pumps, so that we can bring the cost down, because that's now beginning to get good use?
Yeah, absolutely. You can see on Google Maps the flat roofs belonging to the council across Scotland, and very, very few of them have solar panels. And the other thing is community heating. It's much cheaper to do it on a community basis. And I know in Edinburgh you're getting a data centre, but you haven't stipulated that the heat produced should actually go to community heating, people round about, like they're doing some places in the continent. So there are, as you say, things that we can do so that we don't waste heat, we don't waste the sun coming down. And sadly, that's not yet in the climate document, but hopefully it will come.
And if we, part of what we were looking at today was actually a website which was built and designed to show co-benefits. Now, when I tried to get onto that website, it isn't actually working, which is a bit of a problem when it comes to trying to scrutinise something. But if we talk about things like active travel, which is certainly something that you've said quite a lot, if we look at Glasgow, we are building a lot of cycle lane infrastructure, which is causing huge problems when it comes to traffic build-up. It's causing huge problems when it comes to people being able to access. And then I have stood and looked at how many people use said infrastructure. And if you discount Uber Eats and other such delivery drivers, very few people are using it. And especially in the winter, you get almost none. And you have to maintain infrastructure because potholes and rubbish and things like that simply mean you can't have active travel. So given that we don't live in Spain and it's nice and warm and we're able to do things, how are we going to increase active travel?
If you have protected cycle lanes, gradually it does increase. Unfortunately, it doesn't increase immediately, and we do have a weather issue. However, along with our wetter winters, we are going to have drier, warmer summers. Now, I know, having gone out and lectured, that parents are really hesitant to let the children go out on bikes. If you don't learn to cycle as a child, it's unlikely that you're going to learn to cycle as an adult. And therefore, we should encourage cycle lanes. So, for example, in the LEZ, because the traffic fell, 4 times more children cycled and walked to work. That's in the ULEZ in London. And so it is a case of getting them there, and then we'll see them being used. But if you don't teach a child to cycle, they're unlikely to start cycling.
But our cycle lanes in Glasgow are not being used.
I'm sorry?
The cycle lanes in Glasgow are not being used. They've been there a while.
Yeah. Have you paired them with children's lessons to cycle? Have you paired them with cycling to school? You know how they go past the houses instead of going by bus, and you pick up a child and you end up with a big long snake of children cycling into work. Do it in the summer, get them used to it, and they will love to cycle. The big problem is that if they're not protected, which I know is what's causing a lot of the problems because it narrows the road, then it doesn't matter if you've got that white line. The injuries and deaths of cyclists is exactly the same as on a main road, or if you've got a white line painted. It has to be protected. But one problem we've got is that you can do a compulsory purchase for a road, but you don't do a compulsory purchase for a cycle lane. And, for example, in 3 areas across Scotland that I know of, the protected cycle lane has been blocked by 1 farmer's field in each occasion, and the council will not go for a compulsory purchase. And if you can use just 5 metres of a field, then you don't have to narrow your road. And OK, that's in the countryside, but at least it stops that road from being narrowed. So that's another area that we really should allow, and that is that we can do a compulsory purchase to allow a protected cycle route so the road is not narrowed further.
And my final question is about food. We've had multiple evidence sessions when it comes to food. And one of the biggest issues is not what the recommendations are, because a lot of people know about 5 portions of fruit and veg, which isn't enough, but people aren't hitting that. And what it comes down to is it seems to be confidence to actually cook and confidence to know what and how to go about things. So wouldn't that be a very important step, rather than simply saying, we should do this, we should do that? Let's actually get people the skills that they need before we move to those recommendations.
Yeah, the recommendations and the targets, I mean, I think the best way to kind of look at them is to say, right, okay, well, this is what the government is kind of portraying as saying, this is what we're aiming for, and hence we will then build public health infrastructure, policies, interventions, support in order to help people achieve those diets. They're not an intervention in itself. I mean, as you well know, you can't just give someone a copy of the Eat Well guide and say, well, that's it, okay, that's fine, and they're going to achieve a healthy diet. We need lots of support, and I agree with you. I think that kind of providing support and ability for people, getting people more confident in their cooking ability, to understand more around kind of preparing foods from kind of raw ingredients and preparing foods from scratch is all going to be helpful. And that's something that, if we're going to get towards that, then we need some pretty serious kind of changes, pretty serious societal changes, because these are things that they're infrastructure problems that mean that people have kind of lost these skills as we're moving along. In terms of the way that people's houses are set up, the way that people's time is set up, so they don't have time to do cooking, they don't have time to kind of prepare meals, the way that we prioritise food in schools and in our work environments. So in different cultures, you see cultures that have kind of a countries that have a strong food culture, like France, like Japan, like Italy, will devote time during the day for food. Yeah, so at work there will be devoted time where people get together and eat together. There will be the same thing at school. Too often in the UK, it's food is seen as kind of just an afterthought. That's just something that needs to be rushed and get out of the way. Now, if you're going to have that sort of culture, obviously you're going to lead towards convenience foods. Obviously, you're going to lean towards more processed foods, and that just kind of. Then you've got this kind of cycle going on where these foods are available and people are losing the skills that are kind of all brought together. So I agree with you, and the only concern I have when it's focused on saying, well, what we need is to improve people's skills and people's education around food, is too often what that leads to is a policy which, frankly, is not adequate up to the skills of the size of the task that's needed to kind of change the kind of culture. So if what we're talking about is saying, well, let's increase and have another cooking lesson every half hour in schools, that's not even going to scratch the surface. We're talking about making major changes in order to get people more confident with food and instill the kind of food culture within the UK. Also, I think what you can do alongside that, because I don't think that these two things are mutually exclusive, is to change the kind of food environment, to change the environment where people are making their food choices so that healthier choices are the easier choices to make. So we've seen that with quite a lot of different policies that are being rolled out around the UK, around things like promotions, price-based and position-based promotions on unhealthy foods. We've just recently seen unhealthy foods being banned to be advertised up until 9 p.m. And no paid-for online advertising of unhealthy foods, all through this kind of nutrient profile model, which defines which foods are unhealthy, and then you can kind of put things in place. So there's those kind of things can be rolled out and kind of extended. You've got the soft drink industry levy in order to kind of make those kind of push factors, which is just helping people to choose a healthier diet. But we know that nothing's going to work just on its own. This is about doing a lot of things in harmony in order to really kind of change that dial, because there's quite a big change that needs to be made. And if you look, and again, there's the danger when you go to the smoking comparison that people think that what we're saying is, okay, well, that's the similar sort of level of kind of health impact. No, smoking is much worse for your health than poor diet is. Okay, we know that. We know from the statistics. But it doesn't mean we can't learn from the smoking case as well about what works. So we got from like sort of the 1970s down to where smoking, about 50% of people in the UK smoked, down to about, I think it's about 15% now or something like this in the UK. But that's because there was a series of interventions, all sorts of interventions, tax increases, but also kind of advertising bans, marketing restrictions, changes in the way that cigarettes are being able to be sourced, changes in the way that they're displayed in shops. All these things, one after another, and they help just kind of change the kind of societal practices towards smoking and change kind of behaviour in that direction. And that's what we need in diet. So I do agree with you. We need to kind of change the food culture, but we can do so much more than that as well. We can do lots of things, and the only way we're going to change that food culture is if we're doing lots of things simultaneously.
Thank you.
Joe Fitzpatrick.
Thanks very much, Convener. Professor Belch talked about LEZs a couple of times earlier on, and I do think it's important that we don't miss the opportunity to hear some of the evidence in terms of the health benefits of LEZs, because even in Dundee, where we both live, a relatively tight LEZ, but still people saying that we should get rid of it and scrap it because it's not going to benefit. So it'd be good to kind of hear some of the evidence from Scotland and perhaps further afield about why we shouldn't just have LEZs, but we should be expanding them.
Thank you. The UK is late to the table in terms of LEZs. And if I give you some examples, in Tokyo, they saw a dramatic fall in deaths in children under 2 years. In the US, they saw decreased in prescription medication needs in children up to the age of 5 years, and also a decrease in baby deaths. In Paris, interestingly, they found a decrease in pollution levels in a 2.5 kilometre penumbra round the LEZs, because, of course, people are driving in. And so, therefore, the benefits were more widespread than just a narrow LEZ. In London, I mentioned that you had increase in productivity, decrease in sickness sign-offs, and children cycling more. In Bradford, there was decreased GP visits from their LEZ. Now, provisionally, and very provisional, I have looked at Dundee, and obviously it's good. The levels have come down within the area. They've also come down within, I would say, probably about 1.5 miles round Dundee, looking at your local monitors. And very provisionally, after 9 months, we are seeing a very small drop in hospital admissions from people who live within the LEZ, which we were surprised at because so many of them are migrating students who come and go. What we do have is we have a project looking at all 4 LEZs in Scotland, and not only looking at hospital admissions, but also doing a cost-benefit analysis of what money we would save from these hospital admissions. And the first analysis will be undertaken in June, which will be a year for 3 of them and 2 years. It's complex because we have to take into account COVID when people were not driving, but their statistics are there. And so in June, hopefully, we will have some evidence or contrary that our LEZs are working or not.
Okay, thank you.
Emma Harper.
Thank you, Convener. Just a quick question, really, it's, regarding preparing food from scratch, for instance, ingredients. I'm thinking about ultra-high processed foods. Are they worse for the climate in their manufacturing and prep? Because I'm thinking about the packaging, I'm thinking about the air miles, I'm thinking about the palm oil, the soy, the stuff that goes into ultra-high processed foods. Does that make them worse for the climate?
Okay, we're actually doing some work around this right at the moment, so it's a great question. Now, I think you've got to be careful with the response. And the reason why is because ultra-processed foods, I'm not sure how useful it is as a categorisation. There's so many different foods that get captured by that branding of ultra-processed foods. And I think around the table, people might be thinking of very different foods when they're considering ultra-processed foods. So, for example, you know, like things like Coca-Cola, right, and things like M&Ms or, you know, confectionery, these kind of like discretionary products, yeah, right? Then quite often you can look at those ultra-processed foods. When we consider those to be the ultra-processed foods, we kind of think, oh, well, any kind of environmental kind of impact of those, well, we want people to be discouraging consuming those anyway. So that's all kind of extra. That's all a kind of waste of resources. It can almost kind of fall within the kind of food waste idea. However, if you start looking at the kind of broader categorisation of ultra-processing, which picks up loads and loads of foods which are kind of common within the food supply, like some industrially made wholemeal breads and white breads that are on the kind of supermarket shelves, they can be substitute replacements for foods that have very high carbon footprints. So my concern over the idea that ultra-processed foods have a negative environmental impact is that all of plant-based meat and dairy alternatives, so your soya milks, your oat milks, your veggie sausages, your veggie burgers, all are in that ultra-processed food category. And we know that all of those foods have much lower carbon footprints than their meat and dairy-based alternatives. So if you actually look at it, the reason for this is because the emissions in the food system that are related from the processing stage and from the packaging stages are actually very small compared to the emissions related at the farm stage and the agricultural stage. Okay, that's where the most of the emissions from the food system happen before the food has left the kind of farm gate. It's about land use and land use change, and it's about agricultural practices. So it's about it's more about the ingredients that are in the food than what's done with the food. Have to be kind of careful with this. There's lots of there's counter examples that you can kind of pick where that's not the case, where there's more impact at different stages, but in general that's the case. So I would say that the relationship between ultra processing and environmental impact is nowhere near as strong as has been suggested in the media and in the in journal articles. So I don't think that is a good strong area where you can kind of see health and environmental co-benefits.
So I'm thinking about...
Move on, Ms Hubbard. It was a brief supplementary. Brian Whittle.
Well, I'll do the brief supplementary. I think you were going to ask, hopefully. You're linking ultra-processed food here to environmental issues. How then does it link between health, the predominance of, or the increasing predominance of ultra-processed food and increasing in ill health? How does ultra-processed food link with health?
Yeah, I mean, again, there's lots and lots of evidence out there. There's umbrella reviews of systematic reviews. There's experimental studies. There's observational studies, and they all will show you that as a whole umbrella category of ultra-processed foods, higher consumption of those ultra-processed foods is linked with negative health outcomes. Okay, so that's quite clear. Where the evidence is less clear is this the case for all foods within that category, or is this just because this is a broad category which is containing a lot of foods which have known negative health outcomes, is it just those foods that kind of driving the kind of negative health outcomes? So there are certainly open questions about which of the foods within that ultra-processed food category are driving health outcomes, about which of the processes. Is it about the processes that are involved? Is it about the ingredients that are involved? What is it around those ultra-processed foods that are causing the health outcome? And there's a lot of ongoing research that is looking into that to kind of try and unpick that. But without a doubt, I mean, the evidence is clear that increased consumption of ultra-processed foods is linked with negative health outcomes.
Gillian Mackay.
Thanks, Convener. To what extent could the climate change plan and government policy be bolder in applying the polluter pays principle?
Yes, it could. Very much so. That's one of the comments that I made on the climate change when it was out for consultation. We don't really have teeth in terms of making polluters pay. And the recent SEPA changes, where they're shaming and naming people on their website, I think is not adequate. Actually, you should be paying for your pollution. A lot of the pollution that we see is quite serious. They try to clean it up, but there's a lot of damage that is done, and we don't have any mechanism to make the polluter pay for that. So I think that's a very good point and a very strong issue that needs to be addressed.
In its submission to the committee, the Royal College of Physicians of Edinburgh recommended making the healthy low-carbon choice the easiest and most affordable. To what extent is this enabled by the climate change plan, and how could the plan be improved in this regard?
The issue is the climate change plan tends more to deal with how the government will manage climate change. And that's why this public campaign that I talk about could be very useful, because, for example, electric vehicles, people don't realise that a lot of the EVs now do 400 miles, and actually hardly anybody drives more than 400 miles in one go. And yet, I can't do it, range anxiety. And education, even allowing people to drive a car for a week to see, I go to Ninewells every day. I charge my car once a week only, and I live in Perth. And to be honest with you, I think it's a lot of it is education. And so that's one way with electric cars, but also things like healthy exercise, healthy eating. It's all about public engagement. There's a really good study showing where they asked a couple of thousand people if they should inhale cigarette smoke, other people's cigarette smoke, and only 20% of people said that it was okay to do so, and they're clearly the smokers. But when they were asked the same question about whether it was right that people should breathe your car fumes, then it was completely reversed, and only 20% of people said that they thought it was wrong. Everybody else thought it was okay. And, of course, we know that it's absolutely not okay, and yet people don't really know. And I think we need more climate change. I know it's in the curriculum for excellence now, but we need more education, not so much about, that it's going to be hotter or wetter or whatever, but this is what you can do to help and how you can change your own carbon footprint.
Is there anything on the food side of things that could be improved?
Well, so, again, I just go back to what I said at the start of the meeting, which is in the actual draft climate change plan that I read, there doesn't seem to be any kind of motivation around trying to, or certainly no policies that are put in place around trying to change people's diets. There's goals around agriculture, and there's goals around producing food with lower emissions, but not actually changing diets. Now, obviously, in the Committee on Climate Change report, carbon budgets, it's very clear that it says there needs to be a reduction in meat in order to meet these pathways. And the Food Standards Scotland's report around kind of lowering that level of red and processed meat recommendation, again, is aligned there. But these aren't policies, these are targets, yeah? So I totally agree that we need to be making the healthy, sustainable choice the easy choice. Yeah, that's definitely the case. That's just good public health policy. But I don't see any policy actions to critique, because there's none in there that I can see.
That's great. And Professor Belch just touched on my second question a little bit. Phrases such as just transition, net zero, a lot of the plans don't mean an awful lot to the public in substantial terms, and yet a lot of the things we need people to do around climate change involve individuals taking action, whether that be on a wider basis or in their own diets. How do we make that communication better, more accessible, and make those choices easier for people so that everybody can feel the improvements, whether to their health or in their local environment?
That's such a good point, and I have to say that over the past year and a half, I have never seen so much misinformation on social media about net zero, and also in some of our tabloid press. I have no idea where it is coming from, but it is extremely dangerous. And again, if you have a billboard with a child coughing, saying this child may not make it to age 15 because of asthma. One of the best things that ever happened, sadly, was poor wee Ella's death. raised the profile. I spoke to her mum, and she's such a big advocate against air pollution, but she has done fantastic things in pushing through the ULEZ in particular in London. So yes, we need to. One of the ways, I think the best ways, is to talk about your children. Everybody loves their children, and there is so much in climate change that is going to be harmful for our children. So if you can phrase it round that, I think that makes a difference. But how we stop the torrent of misinformation on social media, I just do not know. It is appalling, and Ofgem has absolutely no teeth. I mean, I've written many, many times.
So I agree that there's a need for more education and more support within the public for the changes that we're going to need to be made in order to kind of meet kind of climate change plans and meet our net zero targets. So I agree there's that kind of education which we need, bottom-up support which gives space for bold policy action which is going to kind of deliver the net zero goals. So I don't dismiss that we need that education. I think it's there. What I worry about is that then the focus becomes on saying we can do education and we can kind of put the problem on the individual, saying it's up to you to make a change, when actually it's up to changing the infrastructure to kind of really make a difference. That's what we really need to be doing. So really, I think a good example of this is when briefly it was kind of suggested that there was going to be recommendations that people clean up their email inbox, right, in order to like delete their old inboxes so that there'd be less pressure on data centres in terms of, you know, because of the environmental impact that they've got. Where actually, if you want to sort out the kind of pressure on data centres, then you go to the people that are in the AI companies that are kind of like introducing those data centres. You go to people like Apple and say, listen, when you take a photo, put it so it doesn't have to take a little short video bit, rather than kind of just taking an individual image, that you just like massively reducing the amount of file storage that's there. These are much more effective ways of getting kind of real change than asking individuals to do it for you. So that's what I caution against.
No, absolutely. But if we're looking for people to, if we're looking to empower people to make those choices, the number of things out there about food alone, from the Eat Well guide to all these other things, it's quite a complex landscape, and being able to distill that down for people to empower them, I think, is really important, as well as those.
I think it's similar to my response I gave to Sandesh, which is that if we're going to get to a healthy, sustainable diet, that's going to be a culture change. That's going to take loads and loads of different things done simultaneously to kind of move us from where we are to a more healthy and sustainable diet. Now, part of that mix is going to be education and training and support given to individuals, but part of that mix has got to also be population level changes, policy level changes, in order to support healthy and sustainable diets.
That's great. Thanks, Convener.
Carol Morgan.
Thank you, Convener. Thank you. I want to just touch on something which you have both brought into your questions, but just in case there's anything else, and it's about rurality in Scotland. The impact assessment showed that it's about 70% of the population, 6% in a very remote situation, and that the demographic in that area is very different. They talk about patterns changing, sort of retirement, you know, people retiring to these rural areas, and so access to services and things is very different. So I just wanted to ask you if that you were satisfied that the plan does consider this enough, and if there's anything else we should be doing to address sort of health equality or inequality in those more rural and particularly island areas.
I don't feel I particularly have anything on that, so I'll pass it to Jill.
I mean, one of the big issues is public transport. In my own area in Perth and Kinross, there are 4 or 5 villages that only have one bus coming through, and that's at 8:30 in the morning for the school, and then dropping them back at 4:30. And they have to use cars, or they have to use taxis to get into the village, the nearest town, I should say. And so I think that one of the big issues for our rural community is definitely public transport. And it was great to see the initiative for electric buses coming through. But of course, when you are far away, the buses can't make it out. And I think that we do need a stronger policy to improve our public transport. We also need to reverse beaching if we can, because a lot of our rural areas used to have train transport and now they don't. And even the lines we have are troublesome. So, for example, coming to Edinburgh, it's almost half the time by car from Perth than it is by train because of the single track at Ladybank. And the other thing is that if you have better train transport, you will get freight off the roads and make the roads safer for our rural communities where the roads are very narrow. I was disappointed that we didn't reduce our speed limit down to 50, knowing the small roads that we have in our rural communities, where it's very dangerous for walkers and cyclists as well as cars. So I think that public transport here is absolutely key. But also, I think when we introduce these policies, we must always keep our rural community in mind. So, for example, that's why with the wood stoves, I'd rather nobody use them. But I think if we make an exemption for our rural communities, who are often isolated in windy areas, then that would be appropriate. So my message is we have to be very aware, but in particular, we do need to improve our public transport to these remote areas.
Okay, that's helpful. Thank you very much. Thank you.
Thank you. So there's no dedicated section on governance in the draft plan. So how should the Scottish Government ensure that co-benefits are embedded in policy design and budget decisions? And what mechanisms should be put in place to ensure accountability for delivery and ensuring that there's measurable co-benefits over time?
I think the one thing that's missing completely from the document, and I'm assuming it's because it's an overarching document, is quantifiable measures. And you can't have governance unless you have a measure. Mm-hmm. So, for example, I do know that the Scottish Government Air Quality Management Group are discussing lowering the levels that are permitted, but we don't see that in the climate change document. And so I'm assuming, maybe wrongly, that this is the broad picture and that for each individual item there will be measurable deliverables that can be then quantified, and that will allow easy governance. But at the moment, the way this document stands, I think it would be very difficult to have any governance metrics under electricity, under industry, under waste, under pollution, under carbon capture, because there are no metrics in it. And as I say, I might not be naive, but I'm assuming this is the overarching, this is what we'd like to do, and then the policies with the governance will come later. That was my impression. I'm not sure if it's right.
Professor Scarborough.
I would totally concur on measurement. That was the first thing I was going to say. The other 2 points I would say is oversight. So making sure, I presume this will be the case, that people with public health expertise from health backgrounds and from the health departments and directorates are there in the room when policy decisions are being made. I mean, broadly speaking, the climate change plans are cross-departmental, so I'm sure that will be the case. The other thing I would suggest would be independent research. So if you want to kind of investigate and find, well, what are the policies that are working? What are the case studies that are actually delivering benefit, and what can we learn from them? Then you need to be funding academic studies to kind of measure them independently and provide results back to the Scottish Parliament.
That's helpful, and I think the issue of governance is something that the committee and probably other committees will be raising with government when we feedback on the draft plan. I want to pick up on something that you had said earlier, Professor Belch, about embedding health professionals in planning and the importance of that. So should local health and care bodies have a role in further developing the approach to monitoring and evaluation of the draft climate change plan?
Yes, I mean, the biggest health issue for humanity is climate change. And although it's not forecast to be so drastic here, we have got changes. And as you probably know, even this summer, 70 admissions to hospital died from heat stroke across Scotland. And that's not counting the people that were admitted and didn't die. Mm-hmm. And so we do have a problem. And to me, climate change is a health problem, which is why I'm so interested in it. And yes, I do think that it should be embedded, there is a disconnect between central government and local government. And if that could be attenuated with health observers being embedded in most of the departments, I think this would make a real difference.
The only thing I would add to that is that a lot of the challenges around climate change, around the policies that we need to kind of make a difference, there's an awful lot of learning in public health that we've done from here. This is about affecting population level changes, it's about affecting infrastructure, it's about affecting individuals, it's about bringing people along in a direction of channel. It's about tackling things like people's individual autonomy, and so there's difficult decisions to be made, all of which there's a lot of learning from public health research. You've then got like a kind of like sort of background, which is then really interesting because Jill mentioned, okay, well, it might not be affecting Scotland as bad as it affects other places, but then we all have kind of joint responsibility. So how do we kind of like, and so then you've got this thing where public health is kind of driven effectively, I suppose, by ultimately the individual level. It's like, okay, well, I'm doing things which are the benefit for myself, the benefit for my own health and perhaps my family, and moving on from there. Whereas here, this is more about kind of, I suppose, a degree of altruism of like, sort of, we're doing stuff for the community. So there's different, whilst it might be the same levers that we're drawing, and there's certainly things to be learned from public health research and public health experience, the subtle new questions around climate change that need to be kind of thought through properly. So I think any kind of good approach to tackling climate change is going to need to have the kind of public health community embedded in that approach.
May I add to that? Just to say that I think the Scottish Environment, your watchdog, advised that the LEZ should be evaluated for benefit or otherwise. But yet, when we approached the Scottish Government, there were no funds for it. So I had to spend a year getting funds to do it. And I do think that there is a role for key public health research funded by the government that you could easily earmark so that it's not always in competition with research on diabetes, research on hair loss, or whatever, so that you're not competing out in the broader field. So I would agree that we do need to look to where are our questions, what do we need answered, and can we provide at least some seed corn funding for it? That's a plea from an academic.
Thank you for declaring your interest. Can I thank both of you for your attendance today? Unfortunately, due to technical difficulties, both Professor Doherty and Dr Sidmont were unable to participate in the committee's inquiry this morning. However, I'm assured that they have been watching the questions and that they will write to the committee with evidence on their particular areas of expertise where they feel they would be able to add value to our inquiry. At our next meeting, we'll continue to take evidence on the draft climate change plan, hearing from a second panel of witnesses on implications of the plan for the NHS in Scotland. And that concludes the public part of our meeting today.